Have you ever really thought about how tight the connection is between your breathing and your heart? It's incredible, really. Today, we're going to get into what happens when problems in the lungs start putting a serious strain on the heart, so much so that it can lead to heart failure. We're going to break down a condition called Cor Pulmonale, and my goal is to take you from understanding the what to knowing how you can be an empowered, active partner in your own health. So here's our game plan. We'll kick things off with the absolute basics of heart failure. Then, we'll zero in on that specific link between the lungs and the right side of your heart. After that, it's all about solutions, managing the condition, finding your voice in your own care, and wrapping up with some really practical day-to-day tips for living well. Okay, so first things first. Before we can talk about the main event, we've got to build a solid foundation. Let's start with the big question. What even is heart failure? You know, the official NICE guidelines put it really simply. Heart failure doesn't mean your heart has just stopped. Nope. It means the pump isn't quite strong enough to get all the blood where it needs to go throughout the body. Think of it less like a complete stop and more like an efficiency problem. The output just isn't meeting the demand. Now, this is super important to get. Heart failure isn't just one thing. Your heart has two sides, and they do totally different jobs. The left side pumps blood to your whole body. That's the type most people have heard of. But the right side? Its only job is to pump blood to the lungs. And that special connection, the one between the right side of the heart and the lungs, well, that's exactly what we're digging into today.
So let's build right on top of that idea. We're moving into the real heart of the matter now. This critical, fascinating link between your breath and your blood flow.
I love this analogy because it just makes so much sense. Picture the right side of your heart as a simple pump, and its job is to push blood through a hose, that hose being the arteries going to your lungs. But what if you have a chronic lung disease? Well, that's like someone stepping on the hose. It creates all this resistance. The pump, your heart, has to work way, way harder to get the job done. And over time, that constant strain just wears it out. And yep, there's a name for this whole situation: Cor Pulmonale. That's the medical term for when the right side of the heart actually starts to change its shape and function, specifically because of a problem that started in the lungs. It's a type of heart failure, but its origin story is all about the lungs.
So you can see it's kind of like a chain reaction, a domino effect. It starts with the lung disease, right? That leads to lower oxygen in your blood. Your body's response to that is to squeeze the arteries in the lungs, which skyrockets the pressure inside them. And it's that constant, high pressure that the right side of your heart has to fight against every single day, which ultimately leads to that strain and failure we call cor pulmonale. Okay, so we get the problem now. Let's shift gears and talk about what we can do about it. How is this actually managed? Because it's definitely not just about taking a pill. It's about a whole team and a whole plan. The NICE guidelines really lay out a great roadmap for care. It's all about having a specialist team, a multidisciplinary team they call it, working with you. You should have a care plan that's tailored just for you. And this is a big one. You should have a follow-up within 2 weeks of leaving the hospital. For some people, long-term oxygen therapy is a game changer, really helping to ease that pressure on the heart. Now, this next part, honestly, I think this is the most important part of our whole conversation. We're talking about a mindset shift, from just being a patient who receives care to being an active, central partner in your own health journey. I mean, listen to this quote. It's so powerful. This isn't just a nice suggestion. It's a right. The guidelines are crystal clear. You are supposed to be involved. You have the right to get it, to talk about it, and to make the final call on decisions about your own care. And there's a term for this: shared decision-making. It sounds a bit formal, but the idea is really simple. It means you and your healthcare team are in this together. Your treatment plan isn't just about the medical facts. It's about what you want, what your goals are, and what matters most to you in your life. So, what does a good care plan actually look like? Well, it should be your personal playbook. It needs to clearly state your diagnosis and what caused it. It should have every single one of your medicines listed out, and, this is so important, it should tell you exactly which symptoms to watch out for and exactly who to call the second you notice them. Okay, so you've got this plan in your hands. Let's wrap things up by talking about how to put it into action. Because having the knowledge is great, but it's what you do every day that really moves the needle. Here are some super practical lifestyle tips right from the guidelines. Notice that first one says, discuss your salt and fluid intake. It's not a one-size-fits-all rule. It's a conversation. Getting vaccinated is also huge for preventing lung infections that could make everything worse. Oh, and here's a pro tip. Be careful with salt substitutes. A lot of them have potassium, which can sometimes cause other issues. This question really gets to the core of it, doesn't it? Being an active partner isn't just something that happens in a doctor's office for 15 minutes. The real work, the real partnership, happens at home, every single day. And hey, you're not expected to do this all on your own. The guidelines are clear that your team should give you the education and tools you need to monitor yourself effectively. That means knowing what to track, maybe it's your weight or your symptoms, and having a totally clear plan for what to do if something changes. And consistency is everything. If things are pretty stable, you should have a full review of your entire care plan with your team at least every 6 months. It's a chance to make sure your treatment is still working for you and still matches your goals. And of course, if things are changing, you'll be checking in a lot more often than that. So let's end on this thought. This whole explainer isn't just about giving you information, it's about empowering you to use it. So think about it for a second. What's one question, just one, that you can bring to your very next appointment to start building that care plan, to start building that partnership, and to really take the driver's seat in your own health journey?